me. Can everyone see my presentation slide? Okay, excellent.
Yeah.
All right, so we'll just get started. I'm here to talk about what we can, as a police department, do for you. Let me mute all my stuff here. So I'll talk a little bit about myself. My name is Officer Ben Ransom. I have been with the department for 8 years now. I'm just going to throw up a few of my certifications. Most recently, I attended the 40-hour crisis intervention team course, which focuses on assisting individuals who are experiencing a crisis, whether it's mental health related, living with dementia, or some other sensitive need. And so our departments are really, a lot of departments in Illinois and across the country are really focusing in on offering lots of other services that maybe didn't exist or weren't really paid attention to by police departments 5, 10, 15, 20 years ago. And as we realize that there's a lot more social work that's involved with being a police officer these days, and it's not either someone gets arrested or they don't get arrested. There's lots of other gray areas where we can still offer help. Our officers are trained better to handle those situations. So really, really proud to be part of that. Okay, I'll throw that up there. So I did work on patrol for the first 6 years of this career. For the last 2, I've been the crime prevention officer. And I can say that when I was studying criminal justice in college or doing my umpteenth push-up in the police academy, I didn't expect that this is what I would be doing at the police department. In fact, I didn't know never even heard of a crime prevention officer at that point. But I have found that patrolling the streets, it's just one of many ways that our police departments can help people. And because of that, I'm really grateful to be in this position. I get to help people in lots of other ways, and I find it very fulfilling. Because at the end of the day, that's why I became a police officer, was to help people. So hopefully you've heard of me or seen me. I do a lot of quarterly community safety meetings that I host at the police department. We do them all on Zoom now. And crime prevention is a prime function of mine. But I am also the school resource officer. I serve as a point of contact for all our private and public schools, including our universities, Concordia and Dominican. I'm also the point of contact for all of our businesses. As you can imagine, with COVID-19, the regulations and concerns this year with businesses, I've had a lot to work on, a lot of interactions with our local businesses. And which can also be said for my role as the elderly services officer, which is what I'm here to talk about today. So what is an elderly service officer? First of all, we are trained by the Attorney General's office, have certification. They run a really good program of training, and they remain a valuable resource to us throughout the years. I work closely with Oak Park Township Senior Services and Adult Protective Services. So when one of our officers makes contact with someone in the community that we believe can benefit from our services or from the township services, I follow up with that person after the initial contact is made. So our patrol officers will reach out to me, and I will follow up to try to make those connections if we think that they will benefit from being part of a program or making contact with someone to talk to or something like that. In the same manner, if we become aware of someone who appears to be suffering from abuse or neglect, I have close working relationship with Adult Protective Services, which is similar to DCFS for adults. And it's important to note that neglect can be neglected by another person or self-neglect. And this means that like a family member can be taking care of an elderly parent and unknowingly neglecting them. Not that they're doing anything wrong, but they're just not capable or trained to provide the amount of care that needs to be provided. Not equipped to handle situations. So the goal is not necessarily to always bring someone up on charges, but just to get the individual the help and the care that they need. So that's an important distinction when we talk about abuse and neglect. But I do assist our detectives in investigating those cases that are reported to us. I'm working with Adult Protective Services on that. I Also, I'm part of the M team, which is a multidisciplinary team made of police, mental and medical healthcare professionals, social workers, and more. And we meet monthly to discuss specific cases that come up in all of our professions that might need extra analysis or input from other professionals. I am, of course, on dementia-friendly River Forest team. You can see the stickers there at the bottom. We do have a new website up, which we're working on, which is there in the link, dementiafriendlyriverforest.org. And our goal is to just make River Forest more dementia aware and more capable of handling situations for people living with dementia. And like I said, I assist police officers in caring for senior residents, so I reach out and make contacts with all the people that they contact throughout their patrols. So what services do we as a police department offer outside of all the connections that we make with senior services and the resources? First and foremost is the Emergency ID Bracelet program, which was started, I believe, in 2017. It is free, and it consists of, it's a pretty simple program. Program participants get a bracelet with a little placard, seen in the picture, and the placard denotes your medical emergency ID number and any specific information that a first responder would need to know right away. So for instance, you have a bracelet, you're part of the program, you're wearing your bracelet, an ambulance responds to your residence because you're not feeling well. Maybe you're fatigued, maybe you don't have the energy to say anything, to say what ails you. All you do is you just hold up your wrist, they see your bracelet. Our firefighters and Oak Park firefighters are aware of this program, they know what to look for. So now in this picture they see, you know, in this example, nonverbal penicillin allergy, specific information that they should know right now, right? What else can it say? Any other specific need that you have? Okay, you have a pacemaker. You know, really any need, anything that medical professionals need to know, police, what have you. They also get your personal ID number, so they can call our dispatch and get emergency information such as emergency contact information, prime care, physicians, anything else that would maybe take a little while longer to get access to. If it was a medical emergency, you had to be rushed off to the hospital, and now they need to be, you know, find out what kind of medication you've been taking, any other specific things where they need to talk to someone. This is not just for elderly community members, residents. We offer it to anyone who has medical or special needs. So for instance, we do have people living with autism that are taking advantage of this program, and it's free. And so you can simply contact me to learn more and to participate. You can call or email me, and my information will be provided at the end of the presentation, so stay tuned for that. Some other things we do is vacation watch program. If you're going on vacation, if you're going to be gone for an extended period of time, let us know. We can do extra checks on your residents, make sure that they're being looked after. And of course, we advise that along with all the other security measures that you can take, cameras, alarm systems, locking your doors, lights, etc. We do residential surveys to look over what kind of safety measures you have in place. We go through with the clipboard and see if we can make any recommendations for you just to have a safer home and to protect yourself a little better and protect your property as well. One of my favorite things that I get to do is to host a fraud and scam seminar. And I try to do this a minimum of once a year, depending on demand from the community and kind of the scams or frauds that we see popping up. So, you know, if there seems to be a period of time when we get lots of reports about specific phone calls or something that seem like they're scams, then we might be prompted to do another one. But what I try to do is host this in our community room. Last time we had the option to do it over Zoom, and I assume going forward we'll probably just do it strictly on Zoom for the time being. But what it consists of is just educating the public on scams, fraud, and ruse burglaries. There are lots of new scams every day that pop up, so I can't hit all of them, but what I can do is explain how they work, why they work against people, why these criminals will target the elderly population, and the goal is to really prevent our residents from being scammed out of their hard-earned money or, you know, fixed incomes it's a shame to see it and to have to take those reports as police officers. So we can prevent it from the get-go. That's our ultimate goal. I also partner with a member of the United States Securities Exchange Commission, and she puts on her own presentation. We kind of work off each other, and she talks about investment scams, investment fraud, and more the kind of the white collar stuff that goes on behind the scenes, and really stuff that I have no business talking about. So, which is why it's a great partnership, because you kind of get the baseline of how these frauds and scams work, and then kind of the upper echelon of investments and finances and stuff coming from her end. So it's really a good partnership, and she's taught with me for the last 2 years. So while we're on the subject, I do just want to just say briefly that if you suspect, even today, that if you got a phone call or an email or a solicitor at your door and you suspect that something's funny about it, and they're asking for money, demanding money, trying to work off of your fear, just stop, just slow down, because there's no rush for you to give away your money. You can do your own research. If you're computer savvy, you can call a trusted friend for advice. You can look at the Better Business Bureau. You can call the police, or you can even call me directly for a quick tip or a quick advice, because we would rather you call us out and have us prevent it than you have to make a report tomorrow that you lost hundreds, thousands of dollars, and now we have to try to go and recover that for you. Because quite honestly, a lot of times the criminal is working from out of the country, and that money is gone and out of our reach. So slow down. Anyone viewing this, just slow down, think, and call someone for help if you don't know what to do. All right. There's my desk number. I do have people occasionally call me that they got a phone call and they're worried. They hung up on the person, and is the IRS going to come arrest me? Just call us, and or just Google it, and you'll find out pretty quickly that those are usually just scams. Okay. Another great thing that we have at our disposal is the Silver Search program. You guys viewing Silver Search? Can you guys see that? Okay, I'm on the right picture. All right. So the Silver Search program, this is a missing person advisory system for elderly adults and mentally disabled adults. And it notifies the public when a high-risk person goes missing. And it's modeled after the Amber Alert system for children, and it operates in the same way. So it sends out mass notifications, phones, emails about the endangered person, something that we have at our disposal. We just contact the state police to file it. And so I think it's starting to gain some ground. And if you've been on the expressway, you might see the signs that'll say Silver Search, someone's missing. It'll give you a license plate of a car they might be driving. This is specifically a lot for our dementia cases. Someone goes wandering, they're lost. And we get a fair amount of those calls or those interactions with people just daily on our patrols. Someone will call and say, oh, there's someone at the park, they're elderly, they look like they're lost, they look scared or something. And so if we can find them at the park before they start wandering further, that's great. But sometimes they hop in their car, and next thing you know, they're in another town, and they don't know where they are. They think they do, and it just makes it a lot harder. So, but this is something that we can use. And recently, I have put out a reminder and a guide to our officers on how to use this and how to do it quickly and effectively. Other resources that we offer, which come directly from the Attorney General's office, are elder abuse awareness kits, guide to choosing a nursing home, resident rights for people in long-term care, victims compensation applications, guide for senior citizens in protecting your finances. These are all just resources that we have in-house. I mean, just we can print them up for you and provide them for you, or connect you to State's Attorney's office or Attorney General's office, or whomever we have these resources with to help you further. So if any of those look like they would be beneficial, you can contact me as well. So this year, the Village River Forest did an excellent job of recognizing the specific needs of elderly adults, being compromised immune systems, other underlying health issues that put them at greater risk during the COVID-19 pandemic. So they created the Senior Citizen Response Program, to assist with grocery shopping, pharmacy pickup, and more. And some of our other guest speakers might speak more on this, and we're kind of all tapped into promoting these programs. So I'm maybe not the foremost person to speak on everything that they do, but it's a lot of volunteers that are looking to help people. So if you know someone or you are a senior with these conditions or these worries, you can contact them at that phone number provided there. And again, I don't want to step on any toes, but here's just some other programs through the township that I'm aware of up there on the screen for you that might help you or that you can refer to. The Great Neighbors Program, Memory Cafe, these are programs that I will call, and if I see a need that can be met with these programs, I will recommend them to people that our officers come into contact with. And I'm sure with COVID that probably a little bit of the way they operate has changed, but I'm sure they're still using Zoom or some other group talk application to continue doing their meetings, and I've heard great things about them.
Are you going to do the activity then?
So as I said, I host a community safety meeting. It's quarterly. The next one will be the 4th Wednesday of January, and I often have guest speakers from our many partnerships speak in depth on a lot of these programs, these services, how we work together, how they are mutually beneficial for our agency, for other agencies, for the public. And so feel free to start tuning into those because it's always good information and helpful information to our community. And you can check that out on our village website to learn more about it, www.vrf.us. And you can sign up for email newsletters, you can subscribe, or just stay up to date on the events going on within the village, because anything that we put out to the public, we use the village to put it out, whether it be on Facebook or through emails or on the village website. So if you just stay plugged into the village website, you'll kind of learn everything that's coming out from us. And there's probably a lot more that I can talk about, but I think this is just a good start, just to get everyone kind of up to date on what we can do. And really, if we don't have an answer for you directly, I have a lot of answers. If I don't have the answer, I can probably find pretty quickly someone who does. So feel free to reach out to me. I'll put my information up here. And like I said, I am basically your resource to all of our resources. I'm your point of contact. Feel free to reach out to me, email, phone call, and I'll do my best to quickly get you a response. I will open it up to questions, however our host wants to do it.
Yeah, if anyone has a question, feel free to unmute yourself or send a chat and I can unmute you if you don't know how to do that. Does anyone have any questions for Officer Ransom?
Well, I kind of do, Megan, if nobody else does.
Yeah, go ahead, Pat.
I turned in late, so I apologize. How do we get the ID bracelet? My husband has Parkinson's disease, and I don't know that that's one of your diseases, but I would like, and he also thinks he can shovel the snow, but he can't. So Wednesday, we're going to his doctor. Do I need a letter from her to you to tell you that he, even though he thinks he can't do more than 5 or 10 minutes, and then so help, Officer Ransom, thank you.
Sure. Yeah, great question. You can contact me directly. You can give me a phone call. If you want to send me an email on the screen that I'm sharing. Either way, contact me, and I directly register people and work with you to fill out the paperwork. It's only 2 pages, and I get that ordered for you. As far as shoveling, I'm pretty sure that the senior citizen response team will handle that. I think they have over 100 volunteers that would be happy to help out with that. If not, I think there might still be specifically a shoveling program that we did have, I think maybe 2 years ago or last year. So I can look into it. Call me for both or email me, and I'll get you connected to all of them.
I did read, I got a message from Ms. Adushi that we do have that shoveling program this year. That's why I asked. Thank you.
Okay, sure. But yeah, so no doctor's note is required.
Okay. Okay.
Yeah.
Officer Ransom, Deborah Hill.
The page that you said Senior Services Support Program, is that through the township?
Yes, that's through the township. I just
Okay.
pulled a bunch of services off of their website. What I do is every so often I'll go on their website and kind of make sure I'm up to date on what they offer. And that's just another thing that I'll print out and give to someone or refer them to if I see a specific need that I can find. So yeah, the township website will offer all of those.
Great, thank you.
Sure.
I'm Betsy Kelly from River Forest Township, so feel free to reach out to me for anything too.
There we go. And as I said, the Attorney General's office is really the driving force behind our elderly service officers, and they have lots of resources that that a lot of people don't know about, even like victims compensation, that kind of stuff, and recouping money that was lost and crimes and stuff. We don't hear a lot about that as police officers. We don't get trained too much on that. So to go through some training on that and learn that that's available, I always try to remind people that that kind of stuff exists. So keep that in mind, and you can visit the Attorney General's website or office to learn more about that kind of stuff as well.
Ruth, did you have a question?
Yes, I did. Shortly after we moved to River Forest, we became aware of the in case of emergency, or the ICE thing that I know that it's not the police department, it's the fire department and the first responders, but I'm not seeing that being promoted particularly much of late. It was a sheet that you actually store in your refrigerator with a little clip magnet that you put on the outside of the refrigerator so that they would be able to know who your contact information is. Do you know if that's still a program that's being offered through the village or the township?
Yeah, I believe that is. Well, looks like Betsy's nodding her head. Can you
Yeah,
talk
no,
about
I've reached out to the fire department, and that reminds me to reach out to them again. So I'll make sure we start posting that information again. I believe it's still going on, maybe just quieter during COVID time.
Yeah, I believe it is too. And if Betsy, if you want to follow up with me, then I can start adding it to my presentation as well, so we can make sure that everyone's aware of it. Thank you.
Okay, sounds good. Thanks, Ruth.
And you're also able to pick those up at the library. We do have some of those ice packets here if anyone wants to
There you go.
sign up for that.
Excellent.
Great. Thank you.
Any other questions?
All
If
right.
not, you have my information. If you think of something later, don't hesitate to call. I'm easy to talk to, easygoing. So if you have a quick question, feel free to ask.
Well, thank you so much, Officer Ransom. That was
Officer
really
Ransom.
helpful.
All right, my pleasure. Am I still sharing my screen, or did you?
I ended it, so
Okay,
you're all
excellent.
good.
All right. Thank you, everyone. Thank you for your time.
Thank you. So